Hello, welcome to your Medical Language 2 course. Most of you, as a matter of fact, I believe all of you that are in your Medical Language 2 course are also in Medical Language 1. So you're going to be doing these two courses simultaneously. In this particular presentation, I'm going to go over, I'm going to do a brief overview of what you're going to see in this week's chapters. And then, as I did in the other course, I am also going to go through and look at some specific things that are special to this course within Canvas so that you can see how to do certain things. So, excuse me. First, let's look at the material for this week. This week we're going to be covering two chapters. The first chapter is all about the female reproductive system. As most of you go through this, you're going to find that a lot of the material that you're learning is probably things you've learned in the past, things you might have covered in a health class, things like that. You're going to learn all about the different body parts, disease states, but what I want you to focus on, in addition to learning those body parts as you go through this chapter, is learning those disease states, those disorders associated with the reproductive system, and those drugs that are used to treat them. And that's going to be your focus in all of these chapters. I really want you to focus on the drugs used to treat these different diseases and disorders, so that when you are presented with them in a pharmacy, that you are familiar with what this is all about. So this is just an example. This is a table right out of your textbook, but it talks about things like, since we're talking about the female reproductive system, we're looking at things like hormone replacement therapy, birth control pills, oxytocin. If you've ever had Pitocin, you know what this is all about. Pitocin is used to induce labor. So these are just different things that you're going to see in these chapters that I really want you to focus on. Focus on those drugs. Those are the things that you're going to be dealing with most frequently as you get into the pharmacy. The second chapter that you're going to be covering is the chapter dealing with the pediatric patient. And this particular chapter is mostly about identifying pediatric patients and kind of getting into some of those disease states. Not necessarily body parts and things like that, just specifically that group of patients. And the thing to keep in mind with our pediatric patients is they're not just little people. They're not just small adults. There's a lot going on in a child during their different developmental stages. I've written down some of those different stages. We talk about the prenatal period being that period before they're born, so from conception to birth. From infancy and toddlerhood, that's birth to 2. Early childhood is from 2 to 6. Middle child is 6 to 11, and adolescence is 11 to 18. And even at that point, we do know things like the brain is not finished growing at that point. So different things are happening at different stages in the child's development. An important thing to keep in mind is water-soluble versus fat-soluble drugs. Those change over time. So rather than needing more as you get older, you actually need less. And that's something that most people are not aware of. So as we get into this and we look at pediatric patients, it's really important to understand that it's not just a matter of taking an adult dose and cutting it in half or something like that. There's a lot more to it. When we look at development, in addition to looking at age, we're also going to be looking at specific pieces of that development. So things like their physical growth, which is obviously things like sitting, standing, walking, that kind of stuff. And that's probably the most obvious thing, right? We see them growing. We see them getting larger and things like that and moving around. The next piece is cognitive development. And again, every child is different when it comes to their cognitive development, but this is things like reading and speaking, comprehending things. So, them being able to understand the word no, that kind of stuff, that all falls into cognitive development. And then the social and emotional development is those relationships. So being able to work with their siblings and, share and those kinds of things. And those, again, all change during different phases of development. We all know that 2-year-olds are not the best at sharing, right? But that is a skill that they have to learn. And as they progress, we would expect that by the time somebody reaches their middle childhood ages, when they reach 10 and 11 years old, they should know how to do that, right? So those are the kinds of things that we're going to be looking at. Now, there's a lot of different pathological conditions when you are going through and looking at the list. You're going to see a ton of different things. They range from some of the more, not so, I guess you could say not so bad things like croup. Croup can be bad, but things like croup and chickenpox, asthma, to some very rare and serious conditions. Turner syndrome is one that they talk about. So it's really important that we become familiar with these different conditions so that we can learn about the different medications used to treat those conditions, because you're going to have a parent come in and say, I took my child to the pediatrician and the doctor said they have fill in the blank, and they gave me fill in the blank. And you need to be able to go, I think maybe that's not what they gave you, because that's not what that particular drug is for. Or, well, yes, that is a drug that you might be using, but it's usually used for fill in the blank. And so those are some really important things to be able to recognize when you see those medications, those prescriptions come through. And finally, here is your link to StudyWare. Again, it's just like in the other book. It's the exact same link. So what you're going to be doing is you're going to use this to quiz yourself. So you're going to go through and learn some of the material, talk about, the different topics. You're going to quiz yourself. You're going to do word bank type things. There's a concentration game you can do, all of those kinds of things. So that's a great tool for this entire textbook. Now, as I did in the other course, I'm going to go ahead and share my screen so that I can show you a couple specific things in this course. So let me do that real quick. And we're going to share my screen. And the first thing that you're going to see, again, is my grandchildren. And so let me pull up your course. So in your course, and I'm going to just kind of rearrange the screen a little bit so you can see a few more things. Once you're in your actual course, just like in your other courses, you're going to have your announcements. And this is a great place, again, to get that information that's specific to this course. And you'll notice that in addition to my contact information and your week 1 announcement, I have a specific announcement about those pronunciation tests. You may have seen those on the modules and weren't sure what you were supposed to do. So if you click on pronunciation tests, it's going to tell you a little bit about what I'm looking for. And a lot of us are auditory learners. We need to hear it first. I can read it, but I really want to be able to hear how to pronounce that drug. So I've given you some links on how to do that. And for example, this particular link is to a specific drug. Let me just click on it for you real quick. Once that opens up, you can see that once you get into here and you see the drug name, notice this little icon here. That is the audio pronunciation. And if we click on it,
escitalopram,
it will pronounce it for you. So you can go up here in the search box and type in any of those drugs from your list, and it will pronounce it for you. And I really, really, really recommend that you look at that list, go in and listen to them, practice them, practice listening to them and pronouncing them yourselves before you do the test. Now, as far as the test goes, and we're going to go back into modules here, and you will see, again, it's set up just like it is in the other course. But you will see that one of the things that you're doing besides your assignment and your quiz is your pronunciation test. So when you click on the pronunciation test, this is where you have the list of words. And it's got, these things like, is it a brand or a generic? What's its classification? What's it for? You don't have to turn those into me, but what I'm giving you that for is so that you can start to learn some of these. These are the top 200 drugs. These are the drugs you're going to see all the time. So it's really important that you become familiar with them. But what you are going to do is you're going to call my phone number. So you're going to go to my announcements, look at my phone number. You're going to call my phone number each week. You're going to give your name. You're going to say, this is Sally, and this is my week 1 pronunciation test. And you're going to just start going through, and you're going to read Abilify, acetaminophen, acyclovir, Adderall, albuterol, allopurinol, alprazolam, Ambien. And I'm going to stop there because that one's a little challenging for you. So make sure you look them up, guys. Make sure you're checking them out, and make sure that you know how to pronounce them. Practice them before you call me. And you're just going to leave me a voicemail. And I listen to those at the end of the week, and then I go in and post your grades. If you have any problems or questions with any of these things, please make sure you reach out to me and let me know. And hope you have a great week, and talk to you soon.